Multilateral Leaders Task Force on COVID-19, MLT, including the heads of the International Monetary Fund, World Bank Group, World Health Organization, World Trade Organization, in a meeting with leaders of the African Vaccine Acquisition Trust, AVAT, Africa CDC, Gavi, and UNICEF, say that the crisis of vaccine inequity is driving a dangerous divergence in COVID-19 survival rates in the global economy. While appreciating the important work of AVAT and COVAX, they say the global rollout of vaccines is progressing at two alarming different speeds. According to them, low and lower middle-income countries, the majority of which are in Africa, simply cannot access sufficient vaccine to meet even the global goals of 10% coverage in all countries by September and 40% by end of 2021, let alone the African Union's goal of 70% in 2022. They're calling on countries that have contracted high volumes of vaccines to swap near-term delivery schedules with COVAX and AVAT. They're calling on manufacturers to immediately prioritize and also fulfill their contracts to COVAX and AVAT. They're urging G7 and all dose-sharing countries to also fulfill their pledges urgently. They're asking for support for ancillary supplies, saying that barely 10% of nearly 900 million committed doses have so far been shipped. Well, joining us to talk more about this on the program is Dr. Gitahi, is AMREF Health Africa Group Chief Executive Officer, and he joins us virtually on the program from Nairobi. Thank you for joining us.
Thank you very much, and thanks for having me.
Great. You've made outstanding contributions to the health sector in your work at the helm of AMREF Health Africa, among other positions. What's your take on how African governments are fighting the coronavirus pandemic?
Well, my take is that the African governments have struggled, but with the best intentions. We've seen that African governments struggled very early on and closed their borders very early. They had a very robust response. But then again, as we say, the virus was always several steps ahead of everyone, and it was so in Africa as well. And therefore, the governments have spent their time chasing the virus, so to say. And that has not been very easy, though the guidance of Africa Centers for Disease Control and Prevention, which is a part of the Africa Union, has been actually instrumental in the continental response. You know that when we got Ebola a few years ago, we did not have an institution like the Africa Centers for Disease Control, or Africa CDC. And we have seen the value of that institution now with the pandemic. So I would say that it has been a very commendable response to this pandemic this time around.
But for you, what would you say the biggest challenge was or is for some of the countries?
I think for across the continent, the biggest challenge has been how to balance lives and livelihoods. Because we know that 80% of Africans work in the informal sector, meaning that when you actually take the measures that were earlier advised, which was about lockdown or partial lockdowns, and even curfews, which are still holding a lot in many countries, then you're left behind with a fractured economy, a fractured social fiber. And how do you decide when livelihoods are more important than lives and vice versa? You know, lives are always of value. But then we have seen unrest in some governments, in some countries, because people are hungry and they are socially under pressure. We've seen mental health illnesses rising. We've seen gender-based violence rising. And these things are rising because of the measures, the public health measures, which are well-meaning, that are being taken. So this has been the biggest challenge. And you've seen governments, titrate, moving from a bit of curfew, a bit of lockdown here and there, then moving back. And many governments now, because of course there is widespread community spread, have actually abandoned lockdowns or serious cessational movements and have remained with limited measures like curfew, but allowed business to go on, the informal sector to go on. The markets are open, the schools are open. So this has been the biggest challenge. But then, of course, there has been the challenge of resources. That because we don't have universal health coverage in the continent, people get admitted because of COVID, they don't know who pays for it because we don't have social health insurance in the continent. So people have been left with huge bills. I was talking to someone today, a governor of one of the counties in Kenya, who said on average it's costing about $6,000 to treat a COVID patient for 2 weeks. when you actually look at a continent without universal health coverage, that means people have to dig into their pockets, sell their livestock, sell their land, and therefore health itself, COVID itself is creating poverty by admission, even beyond the socioeconomic measures. So this is the other challenge of resources and a fractured economy. But finally, vaccines, that we can't access them. And therefore, the final point of control of the pandemic, which is vaccinating as many people as rapidly as possible, Africa has been left behind through vaccine apartheid, through measures that are completely unacceptable, where countries are adding the booster doses, they are vaccinating low-risk individuals, individuals, yet Africa has not even gone beyond the 3% of its population to be able to provide some form of response and safety measures for its population. This is now going to be the next battleground for vaccine equity for this continent.
Dr. Gitahi, can you blame them? They have the money, they can afford to, and they want to safeguard their population. Yes, you've also been of the view that vaccines are like safety belts, which doesn't necessarily stop accidents but confer protection. I mean, in terms of production of COVID-19 vaccines, what is delaying the continent, Africa, from producing it? And this is looking at the future of a pandemic that we're going to have to live with.
Well, Africa has not had a history of manufacturing vaccines. We know that Africa manufactures only 1% of its current consumption of childhood vaccines. And that 1%, and of course, including some adulthood vaccines like yellow fever. The reason for this has been obviously resources. Africa's population is 17% of the global population, but the economy of Africa contributes about 2% of the global economy. Now, this means that actually Africa's and African continent is resource poor in terms of the GDP. We can argue about all the other political issues about, the resource flight and also governance, which is obviously a big challenge, where resources may not be harnessed because of governance challenges. We can talk about unexploited resources, and we can even talk about post-colonial exploitation of the continent. But let us talk about what we know and what is here now, that Africa has a small economy for its population. And therefore, even when you look at the health sector, which ideally should be the one that is going to finance absorption of commodities like vaccines, if you are to take the tax level, allocate the health budget to individuals, Africa ends up with $50 per person per year. Compare that with $4,000 per person per year in the UK, $10,000 or $5,000 of public money in the US. So we have no money. So that's the first thing, that there is no money to do large-scale vaccine manufacturing. But there is also another problem, that because of this lack of money, the world has found a mechanism called the Global Vaccine Alliance, which delivers vaccines to Africa through what we call Gavi. Africa is the biggest recipient of vaccines from UNICEF that distributes vaccine globally. 60% of all vaccines by UNICEF are delivered to the continent. Now, the challenge we have is because of the resource poverty, there has not been industries that have been developed for this. And even if we have developed industries, there is a challenge of supply of market dynamics, because the biggest purchaser of vaccines for this continent would have to be the Global Vaccine Alliance for now, because countries in Africa, which are fragmented individually, none of them can sustain a full vaccine manufacturing capacity. So basically what I'm saying is that, to answer your question, for us to achieve full-scale manufacturing in the continent, we need resources to begin with. Those resources need to go to research and development. Then the resources need to go to manufacturing and buying raw materials. But eventually, we must ensure that the continent has a market-shaping strategy to ensure there is a common purchase mechanism for vaccines for distribution. No single country in Africa can sustain large-scale manufacturing of vaccines if it's not exporting to the rest of the countries. So Africa will require the countries to come together through the common free trade market, come together through a common vaccine and medicine regulatory agency that is being discussed by African Union, so that eventually we have a common market and a common distribution framework, common regulatory framework, and a common purchaser to distribute. And that could be African Union, or could be Gavi, or could be whoever else that needs to organize it. So it's a complex issue.
All right, indeed, a very complex one. Thank you. Ever passionate about healthcare, universal healthcare in Africa. Thank you so much, Dr. Gitahi, AMREV Health Africa Group Chief Executive Officer. Thanks for joining us on the program.
Thanks for having me. Thank you. Stay safe.